I'm Micah Smith with Denver 7, and welcome to Denver Decides. This community partnership is dedicated to accessible and transparent elections. The partnership includes the League of Women Voters of Denver, Interneighborhood Cooperation, and is presented by Denver 8 TV. Before we begin, we would like to extend a special thank you to our hosts for today's event, the Cherry Creek North Neighborhood Association and the 6th Avenue United Church of Christ. Our mission today is to present a ballot issue forum in anticipation of the general election coming up on Tuesday, November 5th. Among the numerous amendment and ordinance questions on this year's ballot is ballot issue number 2Q. Now, this measure asks Denver voters if the city should raise the local sales tax by 0.34% to raise $70 million annually to help cover operational costs for what some have called the Safety Net Hospital. Let's begin by meeting the participants who will discuss the pros and cons of ballot issue 2Q. Beginning to my right, Dr. Donna Lynn, the current CEO of the Denver Health and Hospital Authority. She will be speaking in favor of ballot issue 2Q. On my left, we have Kim Monson, the president of the Colorado Union of Taxpayers, and she will be speaking in opposition to ballot issue 2Q. Let's welcome both of our speakers. We will begin with 1-minute opening statements from both speakers. So Dr. Lynn, you are up first, speaking for ballot issue 2Q.
Thank you. Well, a yes on 2Q ensures that Denver Health, Colorado's only safety net healthcare system, can continue to provide care to 280,000 patients a year, 16,000 young people in schools, over 80,000 people who need behavioral health care. And should any of you need care today, because you have some trauma, our paramedics would pick you up, take you to Denver Health, as they do 130,000 times a year. All regardless of your insurance status or your ability to pay. Most safety nets in America get about 11% from their local government. Denver Health gets 2.3%. This tax, vetted by over 100 community leaders and 1,000 voters, provides some stability for Denver Health, for pediatric care, for primary care, behavioral health, and emergency and trauma care. It is less than 20 cents per day. Despite the work that we do to tighten our belts, use philanthropy, get federal and state support, our uninsured population is going up at Denver Health. Without this, we will be forced to cut services to some of our most vulnerable citizens.
Thank you, Dr. Lynn. And now the opening statement from Kim Monson, speaking against ballot issue 2Q.
Thank you, Micah. And Donna, it's great to see you again. It's been a long time. Cartoonist Bob Vave said, "I don't know if I can live on my income or not because the government won't let me try it." And Denver Health provides critical care and doctors and nurses and staff, and you do an amazing job. I have a colleague at work that had let pneumonia get out of hand, was taken to Denver Health, and his life was saved. So I really do appreciate that. But Denver Health, like other organizations that provide services, is being overrun with people who've come to Colorado illegally. The city of Denver has spent millions on housing, food, services, cash assistance, and more on people who have come here illegally. And some have come to pursue the American dream, and we love that. But some have come for free stuff, and some have come to hurt us. We don't know. So the Denver Health 2023 report to the city anticipates a 24% increase in uninsured care, asking Denverites to pay higher sales taxes in this time of government-induced inflation, higher food costs, and higher energy costs is not sustainable. I encourage a no vote on ballot question 2Q.
And now, Dr. Lynn, you have an opportunity to ask Ms. Monson a question. We are moving to our question section here. And Ms. Monson, you will have 30 seconds to answer. So Dr. Lynn, your question.
Great. So I'd like to both make a statement and a little bit of a question. Denver Health provides care to anyone regardless of ability to pay. And without Denver Health, I'd like to ask Ms. Monson, where would people, including Denver residents, get their care and be able to function as good citizens, good employees, and good students?
Well, quite frankly, we're not asking that Denver Health not be able to provide those services. But what we are asking is that instead of putting a Band-Aid on this 24% increase because of illegal immigration, that we need to actually address that problem first before we start to ask the people of Denver to pay more in taxes.
Okay, and now Kim Monson, your turn to ask Dr. Lynn a question. Dr. Lynn, you will have 30 seconds to reply.
Because of government-induced inflation, higher food costs, higher energy costs, Denverites are having to make hard choices and cuts in their spending. Where can Denver Health tighten its belt to reduce its spending?
So Denver Health has done a number of things to reduce our spending. In fact, our budget increases by a pretty single-digit number every year. We have frozen executive salaries. We have introduced productivity initiatives. We've done some group purchasing. And I would argue that we are actually, Ernst & Young, who was hired by the city, said we were the most efficient safety net system in the country.
Let's continue with direct questions from our speakers. And Ms. Monson, another question for Dr. Lynn, and as before, you will have 30 seconds to reply.
It's been reported that Denver is per capita has the most illegal immigrants in the country. And so how much is being spent, Dr. Lynn, on individuals in Denver Health regarding people that have come here illegally?
So first, no hospital system in America has the ability to turn away anyone who comes to their door. There's a federal law called EMTALA. We have spent about $10 million over the last year on immigrants who have come here, but I will tell you that the problem Denver Health faces is $140 million for our very own citizens who come without insurance or the ability to pay.
Dr. Lynn, you have a question for Ms. Monson, and Kim, you will have 30 seconds for your response.
Yeah, my question is, if without healthy people, how can we have a healthy society? So I'd love to know what Ms. Monson suggests is the answer to, quite frankly, a broken healthcare system right now that doesn't take care of everybody in the country.
That's a really good question. I think as we've gone through this whole experience of COVID, that individuals need to actually take more ownership of their own health to make sure that they're checking diet, exercise, and do things to be proactive on their own health. And certainly having a critical care facility like Denver Health is important. And again, you do a great job if somebody has been injured, trauma type of injuries. But I think that we as Americans have to take more ownership of our own health care so that we are not continuing to just look to others, pharmaceuticals and hospitals to put a Band-Aid on things that maybe we could do ourselves.
Thank you, Ms. Monson. Our next few rounds will feature our speakers responding to questions submitted by our forum organizers. Each speaker will answer each question, and they will have 30 seconds for their answers. So Dr. Lynn, who is here speaking again in support of ballot issue 2Q, you will be first to answer. Your question is, if this measure is not approved by voters, what is the next best method for the city of Denver to raise funds for Denver Health?
Well, thank you for that. I actually don't think there is a next best method. The city has its own challenges. And as I said, the magnitude of the problem that we face, which is $140 million of uncompensated care, is certainly challenging. We have talked to the federal government, to the state, who allocated $5 million to us this year, but there really isn't another revenue source. The reality is it will mean cuts in services if this ballot measure does not go through.
And now Kim Monson, who is here speaking again against ballot issue 2Q. Your response to that question.
Well, there are two sales tax questions that Denverites will be voting on. If both of these pass, the sales tax rate in Denver will be like 9.6%. That means 9.6% on almost everything that you purchase. Denver does not tax some food items and some other medical items, but that is a tremendous increase, and I would submit to you that that's tax gouging.
We will move on to our next question from our organizers for our guests. And Ms. Monson, you will be first to respond to this one with a 30-second response. Uncompensated care is one of Denver Health's greatest expenses. Will funds from this sales tax make a significant impact on covering the cost of uncompensated care?
One more time, Micah.
Okay. Uncompensated care is one of Denver Health's greatest expenses. Will funds from this sales tax make a significant impact on covering the cost of uncompensated care?
If the sales tax increases, it would actually, I think, be used for uncompensated care. But what we don't see is the money that is being taken out of everyday Colorado's pockets every day because of this tax. And that's one of the problems that people don't realize, is that this makes life less affordable. It makes it more difficult for people to then buy their insurance, their health care. So it's a vicious cycle. Higher taxes and more spending. It's just a vicious cycle.
Dr. Lynn, your response.
This is 20 cents a day for the average person who lives in Colorado. I would suggest that that is important to take care of all of us, take care of some of the more vulnerable people who might be living on the street, young people who are in schools. I think it is a very reasonable price to ensure that people are healthy, they can graduate from schools, and they can be productive employees and citizens in our city.
Let's continue with questions submitted by the forum organizers, and Dr. Lynn, you will respond first for this round. Denver Health serves patients from throughout the metropolitan area. What steps are being taken to secure funding on a region-wide level?
It's a great question. As I said, we take care of patients when they're brought to our emergency room, regardless of whether they live in Denver, the regional area, or around the state. That's a federal law. We have met with our legislators over the last couple of years. They have given Denver Health $11 million over the last 2 years, recognizing that many of our patients do come from Jefferson, Adams, and Arapahoe, and other counties. We've also gotten great support from our 2 senators to support Denver Health, as well as Congresswoman DeGette.
And now, Ms. Monson, your response to that question.
Well, Denver Health definitely does a great job in serving our communities. However, we need to address not put a Band-Aid on what is happening with illegal immigration into the city of Denver. When you bring 40,000 people into this city, we don't know where they came from. We don't know whether or not they're here for free stuff, to hurt us, or for the American dream. We need to actually solve that problem first before we ask people to dig even deeper into their pockets, as they're just trying to rub nickels to keep things together so that they can take care of themselves and their families without government assistance.
In our final round of submitted questions, Ms. Monson, you will be first to answer this question. What other options do you suggest for putting Denver Health on a sustainable financial footing for the long term?
I think that that's a question that each of us are having to ask ourselves. Again, as we're facing higher inflation, higher food costs, higher energy costs, we don't have this unending revenue source. And it's important that governmental entities realize that as well. So as we are having to tighten our belts to make sure that we can make ends meet, I think that we need to ask the same of our governmental agencies and Denver Health.
Now, Dr. Lynn, your response to that question.
Well, I believe that health care is a fundamental right, just like public education. But in America, we don't do that. There are 400,000 people in the state of Colorado who do not have health insurance, whether they work in the gig economy, whether they work for small retailers who can't afford to pay for the cost of health care. Denver Health, unlike every system in Colorado, fills that gap for people who sometimes have communicable diseases that we worry about, who need care to be productive citizens. We pick people up off the street, we take them to the care that they need, and I'm proud of the work that we
Dr.
do.
Lynn. Okay. On behalf of the forum organizers, I would like to thank both of you for your participation in this forum. Let's give them a round of applause. Thank you. We hope we have given you a fair look at the pro and con arguments for ballot issue 2Q. Again, it asks voters if the city should raise the local sales tax by 0.34% to raise $70 million annually to help cover operational costs for what some have called the city's safety net hospital. Our thanks also to the Denver Decides partners, which include Inter-Neighborhood Cooperation and the League of Women Voters of Denver. Denver Decides is presented by Denver 8 TV. We would like to extend a special thank you to our host for today's event, the Cherry Creek North Neighborhood Association and the 6th Avenue United Church of Christ. Remember, the election is Tuesday, November 5th. Let your voice be heard. Be sure you are registered and be sure to vote. For complete election information online, you can go to denverdecides.org. I'm Micah Smith with Denver 7. Thank you for joining us.